Okay, thank you, Dr. Prasad. So for the next talk, I would like to welcome Dr. Jeyaganesh, our senior consultant in Department of Anesthesiology. He is also the head of the Neuroanesthesia Services in UMMC, and he also the treasurer of the Malaysian Society of Neuroanesthesia and Critical Care. Beside the busy schedule, he also very active and have a lot of experience in the motorsports. He's one of the committee member of the Malaysian Society of Motorsport and Traffic Malaysia. And please allow me to quote how the ANSCA, the Australian New Zealand College of Anaesthetists, describe anaesthetists. So most of us will need the care of an anaesthetist at some stage in our life. For example, during the pain relief during birth of the baby, for a routine day-stay procedure of a major operation requiring complex split-second decision that keep the patients alive. So today, Dr. Jaya will expand the horizon by adding the role of the anesthetist in motorsport as well. So please welcome Dr. Jaya for his talk. Thank you.
Okay. Good morning, everyone. Can you all see my slides? Okay. Motorsport and the anesthetist. Why and what is the term no anesthetist, no race? Okay. So when we say basically no anesthetist, no race, I basically mean what I say. So in any international race or even local race sometimes, right? If there is no anesthetist available, the race won't take on. And if any race happens, there will be one anesthetist sitting in one of these cars somewhere in the track while the race is going on, right? These cars are not those normal cars that we see on the road. These cars can go actually as fast as a Formula One car or even faster to be at the spot of crash in case it happens. So why are we so important in motorsport? Because motorsport accidents and injuries are usually associated with high velocity and high impact. And these can be completed involving multiple injuries and multiple severe injuries. And the environment that is required for resuscitations can be very challenging, and the equipment and staff availability also will be very limited. So in this difficult scenario, sometimes we just have to do it. So what are the main roles? Why is anesthetist required? The first role is triaging. When there is a crash, there is sometimes multiple crash. So triaging needs to take place and severity of the cases need to be classified. The anesthetist will take the role of team leader at the site of crash in the track to manage the severely injured riders. And in case resuscitation has to be initiated in the track, the anesthetist again will play the role. Once the rider is stabilized, the anesthetist then will have to accompany or transfer this critically ill patient to a tertiary center or to the medical center in the track. So command and control. Command and control is very important when it comes to track medicine. The anesthetist will have to be in clear command and control of the situation and communicating with the racetrack, race control, and the marshals at the track. So leadership. Anesthetist plays a very important role in leadership, in control, in the process of resuscitation on the track. Clear communication is vital between team members, and the anesthetist will have to communicate not only with the team members, but also with the center called race control. Race control, if nobody aware, is the center where they control all the communications between the team leaders of different components in a race, right? He will be responsible to ensure there is environment is safe to carry out any medical resuscitation and maintain constant communication with the control. The anesthetist will have to give clear instructions to team members to carry out orders whenever it needs to be done. The decisions whether we stay and play or scoop and run again will have to be made on the spot by the anesthetist in charge when there is any crash happens on the track. And in the event the decision was to stay and play, the anesthetist again will take charge of the airway management for the rider. So if you can look at the photos, the anesthetist always takes the airway and have his team in control in communicating and resuscitating the patient on the track. Stay and play. Stay and play is when the rider is unconscious, and therefore they will be better and safer to be stabilized before transfer. When riders are unconscious, sometimes they will require oxygen therapy. They will have to be resuscitated with some fluids. So some time must be taken to stabilize the patient before we transfer. Indeed, if resuscitation and airway management is needed, then the riders who are unconscious will need to be resuscitated, stabilized in the track before transferred to the track medical center. Airway manipulation and resuscitation must be done in a safe environment where resuscitation in the track can be hostile. In case there is crash, there will be a lot of external factors, communications, and safety that needs to be looked after before we can proper initiate resuscitation for the patient. In some scenarios, the race might still be going on while we resuscitating the patient. Therefore, proper communication is vital during this process. And just like resuscitating any other patient, cervical care must be taken during helmet removal and airway manipulation. Lock roll method must be mastered and must be done by 3 personnel during shifting riders to the stretcher. Immediate transfer must be done once stabilization is achieved. So once we have achieved in stabilization of patient, most of these patients will be transferred through an ambulance to the track medical center. Once in the track medical center, they will be further stabilized, and then decisions will usually be made at this level whether these patients are going to be transferred to a nearby tertiary center for further management. Airway management. Airway management in track is different from our routine airway management that what we do in our day-to-day practice in the operation theater, right? Most of the time in track management, there will be certain amount of foreign body suctionings and obstructions to the airway that needs to be taken carefully before we initiate airway manipulation. Right? We have to call for the patient and look for response before we proceed with any airway management. Our routine teaching of head chin lift sometimes can be disastrous in these patients where we only do jaw thrust for patients in the track which are injured. Breathing. Breathing is important. Common things what we do, things like oral pharyngeal airway, back mask the patient, and ensure there is chest expansion. And like I said, make sure oxygen is on, right? Resuscitating and airway management in the racing track will be challenging and not in a very ideal situation. So sometimes mistakes can be made I mean, we can be resuscitating a patient without onning the oxygen or make suring that there's adequate ventilation taking place, right? The most important thing I think is make sure the patient can be ventilated even if we cannot intubate the patient. So how are we going to manage airway in the track, right? As we know, most of the riders in the track lies on the ground, right? So maintaining airway on the ground is different when we maintain airway patients in our operation theater where they are on the OT table, right? So we have to use both our hands and both our elbows resting on the ground, right? Before we can maintain our airway. And this will bring us very close to the patient's face itself. So it's very important for us sometimes to protect ourselves before we can protect the patient. Airway management device. Conventional laryngoscopy or intubating a patient in the racetrack will be almost impossible. It's impossible to intubate a patient using our laryngoscopes or our standard management in a racing track. So in the racing track, when airway management needs to take place, we usually use a supraglottic airway, or we can use a video laryngoscope to secure the airway. These adjuncts will be easier to be inserted in an environment which is hostile and difficult. Don't forget and know your toys, right? Before we get into our work and before we go into the track, we must always know what are the equipments we are carrying with us and where are the equipments located. Like I said, and being in the track and being in a compact environment, sometimes we need to choose and pick what equipments we want to carry with us. And we must know where are the instruments located. So in case of emergency, we know where our equipments are. Resuscitation, right? Invariably, any patients that are injured in the track will be dehydrated and will require certain amounts of resuscitation. So we just like our ATLS protocols that we have, the fluid of choice for resuscitations will usually be crystalloids. We usually insert large bore cannulas, maybe just one, right? We can use either a green or gray granula. And just a clinical tips, inserting granulas in the track is much easier than our operation theater, because most of these patients, when most of these environments are hot and the patients are totally vasodilated and the veins are very clearly visible, right? So these are easier to be done in the track than in our operation theater. While we all are in panic state trying to resuscitate the patient, we should also ensure there is no air bubbles and make sure all the air bubbles are removed before we initiating our crystalloid resuscitation. Make sure medications are all prepared and labeled accordingly, as there will be risk of giving wrong medications at wrong times. Once these patients are stabilized, they will have to be transferred, right? So all riders must be stabilized in the track before transfer. Fracture spleens, airway management, cervical care must all be taken care and initiated in the track before we initiate transfer. Care must always be taken to ensure that the safety of the rider and all the medical personnel are taken care before transfer is done. Again, clear communications must be maintained between race control medical center regarding patient condition before sending. We must always be aware of the surrounding and the current flag situation. When I say current flag situation, meaning there is green flag, red flag, yellow flag, right? I think most of us who are in the motorsport, we will be aware of this. If there is yellow flag, that means the race is still going on, and therefore transfer must be taken while transferring the patient, right? And at no time while transferring a patient in the racetrack, we should cross the racetrack. We cannot cross the racetrack. So we have to find alternative solution, and we must know our track well before we transfer, right? And before we transfer, like any other patients, all basic monitors and portable monitors must be applied before transfer. Walk, not run. It's very important, right? When we are carrying a patient in the stretcher and we are about to transfer to the ambulance, we should always take our time and walk, and don't panic and don't run. In the event we run, a patient can be dropped from the stretcher to the ground, right? And the team leader or the anesthetist in charge must always be in front in the patient's head end. And again, communication is vital between all team members before we transfer and before we move the patient. Make sure all tubes and wires are not loose, right? Once we have resuscitated a patient, there'll be a lot of tubings, wires, monitor wires, right? So we must make sure all of those are very safely secured before we initiate our transfer. Portable monitors with fully charged battery backup. Why did I say fully charged battery backup? Because sometimes race can take place for 3 days. At least most of the international races are stretched over 3 days. And we should always make sure that our equipments are fully charged and checked every day in the morning before we are deployed to the track, right? There are instances in an emergency, our monitors sometimes or our infusion pumps are not charged, and charging them in the racetrack is almost impossible, right? So we always should make sure we have checked and charged all our equipments before we get deployed to the track. Proper planning. Proper planning is another thing that very important before we get deployed to the track, right? We should plan our day and plan our staff properly, because we have very limited staff in the track, and everyone will have to play a role. In a medical team that sits in a medical car, like the photo I showed you, one of those high-powered Mercedes-Benz, there are only 4 people that can be sitting in that car. So among these 4 people, we have to plan ourselves who is going to be in charge of what. So definitely the airway anesthetist will have to take the team leader, anesthetist will take the airway, someone has to take the drugs, and someone has to be taking care of the airway assistance, right? In an event there is multiple crash, even the medical car driver can be utilized as a pair of hands for resuscitation. Be organized, right? So it's very, like I said earlier, we have to be very organized and clear thoughts before we are out in the track. So we have to go through all our checklists, right? Make sure your equipments all are complete, charged, right? IV drips all are in, right? All your team members are present and healthy, right? Make sure you carry enough fluids for yourself, right? With your communication equipment, walkie-talkie must be also charged, and always have the attitude of willing to learn, right? Learning is a continuous process, I think, wherever we go. So in a new environment, I think we have always have a good attitude of willing to learn. Teamwork and never work alone. whatever done in the track and whatever resuscitation done in the track, it's always a team effort and coordination between medical tracks, marshals, and other support services people that are in the track, you know, team leaders from other racing societies, right? So we always have to work in a team and communicate with each other in a crisis. So very important, we never work alone when we are in a hostile environment like in the racing track. And last but not least, we must always enjoy what we are doing, right? I think if we enjoy in what we are doing, we'll always give our best in what we do. So wherever we are, even if we are in the operation theater or even we are in the racing track, we always have to be passionate and enjoy what we are doing to make it a success. Calm before the storm, right? And we always will have a helicopter there to rescue the riders in case anyone is severely injured. So with that, I thank you.
Okay, sorry. Thank you very much, Dr. Jaya, for a very insightful presentation. I think on top of the physiology and pharmacology, now we probably need to learn the color of the flag, and we should put it in our syllabus in anesthesia. Okay, we got few questions here. One is from Prof. YK. I just read through the question. I am very impressed by how anesthesiologists have emerged as leaders in this field. This has been arisen from our skills learned as an anesthesiologist to manage life in our everyday work. How can a junior anesthesiologist retrain to shoulder this role?
Well, I think it must be, like I said, a continuous learning thing, right? So juniors can pick up this as a side interest, right? When I got into this initially, I got this as a hobby and interest. And then later you apply your knowledge and skills that you learned over the years to what you are doing.
Okay. The next one from Prof. Tengku Sarah. If you are not allowed to cross the track, are there any tunnels under the track to get to the other side?
Yes, there's always a support road around the track. In any circuits around the world, there is always a support track. So there will be tunnels around the track, under the track, right? So where patients can be transferred, where logistic people can move around, right? Because sometimes like our Sepang circuit has 15 turns and a complicated shape of a bunga raya, right? So there is always a support track around the track. I mean, there is tunnels, there is side roads, slip roads, where it is accessible for emergency resuscitation or anything to be done. Have you been involved in any crashes in KL? Well, in Sepang circuit itself, I think there were a few crashes during our races, right? Of course, we are been involved in those crashes and resuscitations, right? We do get multiple crashes during our MotoGP in Sepang circuit yearly that we have, right? But most of the time, it is all well coordinated and resuscitated, right? Of course, sometimes there are some hiccups here and there, right? That takes place, which we will do our own post-mortem or post-race meeting and see how we can improve from time to time.
Sorry, Dr. Jia, maybe my mic wasn't working just now. Prof. YK asked, have you been asked to provide international support as a medical doctor for races abroad?
Yes, actually, we have been supporting a few races in developing countries that are newly developing or organizing Formula One races. Like we were involved in the early stages when Singapore was having their race. We were supposed to be involved in Kazakhstan. I think Kazakhstan is organizing their first MotoGP race this year, and we hope to be there helping and supporting them, right? So we do from time to time support races in the neighboring countries, but not very well or always we get involved because of the licensing in each country is different. Like before we can go and resuscitate any patients in any countries abroad, we need to apply and get licensings from their medical board before we can go in. So sometimes that is the limiting factors for us going abroad. And it has been a rule in every country that whenever we organize these international events, like whenever we organize Formula One's events, they must get anesthetists who are certified in their country to be part of the team. So that's how actually people like us get involved in these events, because anesthetists that follows these races all over the world are not certified to practice in all those countries. So they need local talents to support these races.
Okay. And Prof. Rafida also asking, how many anesthetists are usually on standby for each race?
It's usually we have 2 anesthetists, right? And before we can actually go into this F1 and we can stand by, we need to be certified by the Formula One team, right? Or the MotoGP, the FIA and FIM, right? So we have to go for their course, take a small online exams and be certified by FIA and FIM before we can take part in their team track management, right? Because everybody has to, like I said, everybody has to be very well versed of communication and role before we can get into this sort of mass track services.
Okay, I think you have one member here, Dr. Ili Shazana. How do I join the medical team? Dr. Jaya, I'm interested. So you can probably recruit her.
We can actually recruit people, right? It's usually is recruited through the Malaysian Society of Motorsport and Traffic Medicine, right? So they have recruitment through there, right? Whenever we have the races, we have a race coming in, I think October or November this year for MotoGP, right? So we get involved from there and then take it from there.
Okay. And Prof. Tengku Sara also asking, so motorcycles races have more crashes than the F1?
Yes, actually MotoGP has more crashes than Formula One cars, right? But I would say the professional races have less accidents compared to the local races, right?
Okay.
So most of the riders that are in MotoGP and Formula One are all very experienced riders. So we usually have less accidents in our actual MotoGP race, right? Because most of them are skilled. But we have more accidents in the qualifying events, right? We have our Asian Talent Cup motorcycle events. So these are junior riders who just learning how to drive, who wants to secure a position, right? So they will race till the end, right? So these races, sometimes we need to be more careful and vigilant compared to the real Formula One or MotoGP races.
All right. And are you also involved in the go-kart races?
Nope. Actually, we don't get involved in go-kart races because mobilizing our medical team for these events is very huge and robust, right? We need supports from many hospitals. PPUM has been one of our supporters for most of our international races, right? So usually PPUM will send in a team. We get teams from all around Malaysia to come and support. And another main support for these events are usually the army medical teams, right? So if you look at it, the most terminologies that we use, command, control, all these things come from the Army's terminologies, right? Because they are the teams, the main pillars of the support team, right? So covering for small events like go-kart sometimes would be very difficult for us to cover. So we usually concentrate on international events, right, where the rules and regulations are very strict. Like I said in my first flight, right, no anaesthetist, no race. So in the event of MotoGP Malaysia, there is no anaesthetist, they won't race. It's very simple kind of things, right? So these kind of races, when it involves the country, then the country coordinates all the people together to organize these events.
Okay, maybe for the interest of time, I would like to take the last question from Dr. Justin Wong. Potentially controversial question. Was the death of the legendary Ayrton Senna in 1994 a tragedy that was preventable?
Well, of course, I would say it would have been preventable, yes, right? Like I said earlier in one of my slides, don't run, walk, right? A few things that did go wrong from our support service, right? But you must understand that panic, kalang kabut, everybody, when something really happens like this, right? So we tend to forget ourselves and, run on the track. So when you run on the track, of course, you will fall. So now it's part of our clear teaching, walk, don't run, right? So I won't say preventable, of course, contributing, yes, right? But I won't say that is, the soul, it always takes a few multifactorial before things can happen. You see, it's not just one factor that's involved.
Okay, thank you very much, Dr. Jaya, for the wonderful talk. And again, thank you, Dr. Jason, for the wonderful talk in the beginning. So I think we had two wonderful talk today. So I hope it benefits all of us. Any other comment from Dr. Jason or Dr. Prasad?
No, thanks. Thank you.
Okay, if none, so I conclude this CME. Thank you for the speakers and the organizer. So we see you all next week.
Thank you.